tuned to Evergreen Media Network. I'm Cindy Schwartz, and this is the Patient Partners Show. It's a podcast. We're also on iHeartRadio, on Talk Radio. So look us up, listen to us on that, and we appreciate the listeners. I always forget to say that. You know, Jeannie, I do. Jeannie Roll is my co-host. She's in Indiana. I'm in Florida, and we really do appreciate the listeners and to try to get this information out because it helps us too. That's how you and I got together with, sadly, that these things happened to us. So we had to figure out a way to help our minds and help our mission then to go forward. So we didn't want anyone else to have this happen to them. Today, we're going to talk about hospice patients, hospice care, talk about geriatric care. Is that right, Jeannie? And different medications and stuff.
Yes.
Some of these stories harken back to like the turn of the last century, the 1900s to 2000, of what was happening with patients, what was happening. Certainly a lot of really disturbing situations in medical mental health communities, and just oh my goodness. Go ahead, Jeannie.
Well, there's a lady, Marcia Joyner, and she wrote a book, Murdered by Hospice. Now, I know, Cindy, that you had a good experience with hospice.
Mm-hmm. I have.
With my father, did not.
Yeah.
So, I mean, I'm not saying that all hospice is bad. I'm not saying that all are good.
Right.
But you have to be aware.
Yep.
And you need to know your rights before you go to see a doctor or you're in the hospital. You need to know. And a lot of times when you're 65 and on Medicare, hospitals want to persuade you to go into hospice rather than to go into a nursing home and receive care because it is cheaper. So that's what happened with my dad. They said that if you go into a nursing home, well, you can't go into hospice later. You can't do this, you can't do that. And my stepmother, I don't believe she really understood, and I didn't at that time either. But having done a lot of research and stuff, hospice is given an annual cap per patient per year.
Mm-hmm.
In the fiscal year 2026, the amount per person for a hospice patient is $35,361.44. So if a person in hospice lives 6 months or more, hospice would go out of business if all the patients lived longer. So there is no benefit a lot of times for hospice to see that people live longer. If a patient dies in 10 days, 1 month, or anything less than 6 months, then hospice has made a profit on that patient.
Okay.
So
I have a question about that too.
It sounds really cruel to me. Mm-hmm.
So my question is, there are stipulations. You and I have talked about a little bit about this before, and this is just recently a conversation that I've had with a doctor, and there has to be a prognosis of a certain time frame. I want to say it's 6 months, but don't quote me. I'm not the doctor, and I cannot remember what this doctor said. The person has to have been anticipated according to the medical diagnosis to not live any longer than 6 months, if I have that right. They're not going to admit you into a hospice situation unless you have that. You can't just go into hospice. There's got to be a medical diagnosis that puts you there. My dad, it was lung cancer. They gave him, I think it was 6-8 months to live. Like, it might be different in different states. I don't know, but I know it is mandated by Medicare. And his was a lung cancer diagnosis that he said he opted for no further care, as far as no further intervention. That was it. He was done. He said, I'm not having any procedures. I lived my life not being morbid. He had phenomenal care. He had phenomenal care with hospice. My neighbor that lived directly behind me, so the same hospice situation, the same hospice people, wouldn't even drive by the hospice house and the hospice organization because of how poor her care was. So I'm with you. It's like anything else. I can recommend Dr. Smith to you and you go there and you're like, I'd never go to that guy. So that's the sad part about all of this stuff, but you do the best that you can. We've said that on other podcasts and ask as many questions. So go ahead. I just wanted to make that designation because I know that you can't just check yourself into hospice. There's all kinds of stipulations. And I'm sure it's all the rules that the government sets
Right.
up as well. Yeah.
Right. Yeah. Yeah. I mean, it says this, that the criteria to enroll requires the doctor to say the patient has 6 months or less to
Okay.
live.
All right.
So that is criteria. But that's not always the case. And we know that there are some people who have went into hospice and they survive.
Right.
And it could be 1 or 2 years.
Right.
So, and I think it depends on the hospice itself, on how it's ran. But I know in my dad's little drug cocktail bag, there were antipsychotic drugs. And the point was to keep him drugged out of his mind. And he wasn't allowed food or water or an IV. Hospice doesn't, at least here, they didn't do IVs. And, we weren't really prepared for how cruel it seemed.
Okay.
For us. I know for others it may not seem that way, but it seemed to us just very cruel. The drugging part, CBS did an article a few years ago about the drugging of elderly people in nursing homes.
Mm-hmm.
They were finding that for convenience, the nursing home residents were being given antipsychotic drugs to keep them sedated. Reason being is if they're sedated, they don't need help. So but they also found that the patients had a shorter lifespan with these drugs because these drugs have warnings on them saying that they can harm elderly patients.
Yeah, yeah.
So it's just heartbreaking that this stuff goes on.
Right.
Now, we thought my dad would be able to converse with us, but he wasn't able because he was drugged out of his mind.
And what length of time did that happen for? What length of time? A week, a month, 6 months? What length of time was that?
No. He was released into hospice. He broke his hip and he was fine. He was living a normal life. And he was released from hospital into hospice on Monday, and he died Thursday morning at 4:00.
Okay, so like 4 days they had this medication going into him.
Yeah. And before that, he'd went to see his doctor, his family doctor, and he was fine as he could be. And it just, to me, it seemed his death was hastened on. I will always regret it.
Yeah. Well, you didn't know. You didn't know. Yeah.
Yeah. I want people to know that a hospice may not be what they think it is. It is to, be able to die in your own home.
Mm-hmm.
And that is a good thing. But a lot of times people aren't prepared for that. It is very real. I wish that he had been in a nursing home or a hospital, actually.
Yeah.
I think it would have been better.
Yeah, yeah. I'm so sorry about that, Jeannie. I'm so sorry.
Antipsychotic drugs.
Yeah.
They are a big thing. To give them to but these antipsychotic drugs should not be given because nursing homes and hospitals too, they're no longer allowed to physically restrain.
Correct.
People. So the medical community has found a workaround
right.
with doing these drugs. And it is, it is just dangerous to do it. It is, to me, immoral to do it, to make someone immobile just for convenience. But then, HHS this year has agreed to reduce the ratio of caretakers to patients in nursing homes.
And we got like 5 seconds left, Jeannie. Yeah.
A lot of times. And I think that's dangerous.
It is dangerous. So be wary of that. On that note, stay listening to Evergreen Media Network.